Paul Nager. I'm a interventional cardiologist. I work primarily out of Centerpoint Hospital. The heart's pretty much made up of 4 valves, some electricity, some plumbing, and a chunk of muscle. And the object is for us to keep the muscle intact. My part of the picture is actually the arterial supply to that muscle to keep it alive. And so what my job is to make sure if you're having a heart attack or if you have a tight narrowing and it's approachable from a non-surgical point of view, that we open it up with a stent, we can open your artery supply, we can get blood flow to your heart to save your muscle. And that's basically what an interventionalist does. I've been in more than one practice. This is, not my first time to the rodeo, as they say, but this has been my favorite group for a lot of reasons. And one is because everybody kind of works as a team. So if I have one partner that's in the cath lab and needs assistance with an intervention, he'll come to my office while I go to the cath lab. It's always seamless. Everybody has their area of expertise that they're really good at, and so they're available for questioning. If, like, for example, if I'm reading an echo, I can go to the echo guy and say, take a look at that and give me your opinion, and he can come to me and take a look at this, tell me about the arteries, what do you think? So the patient on that side of the experience gets the benefit of multiple opinions, even though they're only seeing one guy. Because of the new technologies that are arising in the cath lab situation, multiple new approaches are going to be possible. We're more hybridized approaches, so we can open a completely closed artery, closing holes in the heart like a VSD or an ASD. The real part of medicine that appeals to me is that I can actually connect with people in a way that I'm honored to serve them, and I'm a lucky guy. I really am, I have to say. And I think as we move into the future, I sort of thank my patients every day for allowing me this experience, because I sometimes think they treat me as much as I treat them.